This presentation will review the importance of oral care with your dysphagia patients and give you tools you can use to prevent aspiration pneumonia.
Oral care is the process of cleaning the mouth using a variety of tools and resources. It's a very important factor in reducing the risk of a patient developing aspiration pneumonia. Basically, anyone able can and should provide oral care or assist with providing oral care for every patient.
There is no set standard in the U.S. for how often oral care should be performed, but it's agreed that a minimum of twice a day, in the morning and at bedtime, is essential. It's important to make sure to go in and prevent secretions from being dried on, because that actually accumulates and promotes bacterial growth. So oral care actually needs to be done more often for patients who are having trouble either following directions. They could be your dementia patients, anyone with increased risk for aspiration needs it more often, or if they have dysphagia and they're on a dysphagia diet. We have over 500 different types of bacteria that thrive in our mouth, and bacteria actually do a lot of good things for us. The difficulty becomes when we don't consistently clear the bacteria and it's allowed to build up. That's when it starts to cause some difficulty. And so when you have patients who either aren't swallowing well, they pocket food, they even have difficulty with dry mouth, those things compound to be able to cause advanced plaque, that it causes gingivitis, cavities, and so it's really important, even though it's normal bacteria, to get in there routinely and do a thorough toothbrushing. Studies have shown that when people are seriously ill, they have surgery or certain medications, there's an increase of bacteria growth in the mouth. The more severe the illness, the more likely the bacteria is to grow, and the faster it is to grow. They did a study in 2002 and they found that just 5 minutes of oral care after each meal significantly reduced the incidence of aspiration pneumonia and the death resulting from that. Helping your patients with oral care can be challenging at times. Make sure to sit the patient upright at the edge of the bed or in a chair. Be careful not to recline them or put them in a semi-upright position, because that really increases the patient's aspiration risk. The patient needs to be able to lean forward to spit, and sometimes that chin tuck posture can prevent material from spilling into the throat during brushing.
Toothbrushes with a suction attachment are particularly helpful for those patients who can't spit during oral care, as well as for those who cough during oral care, indicating possible aspiration. These alternative methods may be a reasonable substitute for oral care after meals. However, patients should ideally use a toothbrush with a small amount of toothpaste at least 2 times a day.
You do need to be careful using mouthwash with patients with swallowing difficulties. They're already having some difficulty managing their secretions. Be aware too that the alcohol mouthwashes dry the mouth and may actually make things worse. Toothpaste, it's important to only use a small amount. Pea size is plenty. And there are toothpastes on the market that can kind of help patients if they're having trouble from dry mouth. And there are other moisturizing products that are available from different companies.
Oral care is extremely important for our patients with dentures and partials. 2 times a day cleaning is required for dentures, partials, and the oral cavity. Those without any teeth at all also require oral care 2 times a day.
When you have patients who are challenging, either with behaviors or some dementia, there are some tools you can use to help. There's such a thing as a mouth prop for patients who can't keep their mouths open independently, and they are disposable and available for purchase. You can also do a homemade one with a tongue depressor and gauze. It's important when you have someone with just some cognitive impairment to do a tell, show, do, where you can actually tell them what you're going to do, demonstrate it to them, and then following those very same steps. It's important to give clear, concise directions and make sure that you kind of model on yourself and then do exactly the same thing for the patient. This really helps let them know what's coming, reduces the anxiety, and if you do it consistently, it'll be something that they become comfortable with.